contact goal. They understand the challenges of this year. We started late in general, right in the beginning of December, and
Stop.
I guess we're killing it for a second. Hold on. There we go.
All right. Hey, welcome everybody to this week's town hall. I'm Colonel Harris, your Mission Support Group Commander here at Edwards, and I'm joined by Chief Master Sergeant Swiss-Tac, the Senior Enlisted Leader for the Mission Support Group. We're pretty deep into the bench here for leadership, and we'll get to the reasons as to why here shortly with our special guests, Lieutenant Colonel Westy from Public Health, and then but first we're going to get started with the Combined Federal Campaign. We have our Wing POC, First Lieutenant Mechkov, and we'll turn it over to him.
good afternoon, everyone. I'm Lieutenant Mechkov, the Wing CFC rep. So hopefully by now you've seen some emails come out from your local unit POCs about the CFC. Hopefully you've had those resources available to you to donate if you wish. And we have about 1 week left. So we're about 4 or 5 weeks into it right now. 1 more week to go. So finishing strong. If we want to bring those slides up, thank you. My assistant installation POC is Lieutenant Dawson. She couldn't be here today, but she has helped out tremendously with this campaign. Like I said, we have about 1 more week to go for the CFC, so we'll end next Friday to get all of our donations and pledges in. So our parent organization, the Southern California CFC, set a 100% virtual contact goal. So that is just reaching out and providing resources to everyone under our purview. So they understood the challenges. They didn't want to set a monetary goal. We started right in the beginning of December, had about 2 weeks until the holidays. And so there were many opportunities to give, not just to the CFC, but to a whole bunch of different organizations. So they didn't want to set a monetary goal. For locally, we set a $100,000 monetary goal. Arbitrary, but somewhat riding off of last year's values. Last year we did about 60,000, and this year we're inching up closer to about 50,000 right now with 1 week to go. Couple challenges, right? We don't have we're not doing in-person pledges, so we're not doing paper pledges. Everything is virtual this year, and like I said, the timing is a little challenging, but we're pushing through and we're getting there. So we got 1 more week to push. This year's theme is you can be the face of change. It is the 60th anniversary, so something that Southern California CFC as well as ourselves have been advertising is the $60 pledge. So along with the 60th year, we're looking at roughly $5 a month for the year, which equals $60 or a one-time $60 pledge. That's our goal. But any amount, you can even donate time if you wish. You can volunteer. So if we can hit that next slide, yeah, thank you. So here on Edwards, we've accounted for about 8,000 personnel. We're even including Plant 42, and they've been contributing, so that's awesome. That's between civilian and military. A common misconception is that contractors cannot donate through the CFC, but that is in fact a misconception. They can. So if you're a contractor and you want to donate, you can use the CFC portal in order to do that. A couple ways we've reached out or advertised is through posters, email. Hopefully you've seen those in your organization or your units. The thermometer signs outside the base, we've been having those up. And for next week, we will have a table at the BX for the last week and a couple different goodies and things to hand out just to promote CFC one more time. So hopefully you've seen over the emails that we've been doing the causes of the week, and that's supposed to give you something to donate towards. You can filter based off the cause. So if you want to donate, you don't know a specific charity, but you want to donate toward a cause, you can actually filter based on that cause. So this week is pretty fitting, medical research. And so this is the one that I actually donated to myself. But there's a ton of great causes out there. Next week is kind of a choose your own. There isn't one that we're pushing harder than any other. It's just open and it provides one last opportunity to pledge. Now, how do you pledge? If we want to, one more slide. There we go. So it's pretty simple. There's two ways you can pledge that we are pushing. That is either the website or the app. And so you just go on either one, you create an account, and then you choose your cause. You can choose your cause or a specific charity that you like. You can make a pledge with a credit card, a bank account, an allotment out of your pay. And you can have that either recurring or a one-time. So it's pretty simple. That's about it. That's it really couldn't be much easier. If we want to go next slide. So we have the QR codes here for you. If you want to just scan with your phone, you can start your pledge or just learn more about charities. Also, you can go to the givecfc.org website, enter your zip code, and then they will basically direct you to the Southern California one. And so one thing that I've noticed is that the website doesn't actually have a lot of the unit codes. That's something we brought up, and hopefully in the future they can add more. But for example, I'm in the comm squadron, and the comm squadron doesn't have our own unit code. I also couldn't find one for the MSG, so I went up to the wing unit code. So the unit codes I put below are ones that I'm recommending. If you can't find a unit code specific for your unit, these are for the wing. And so the civilian just test wing at Edwards, that's the unit code, and that's the unit code if you're active duty. So that'll at least put you in the Edwards realm. With that, stand by for any questions if there are any. But yeah, hopefully you get out there, make a pledge. If you didn't get to during the holidays, this is one last time that you get to feel good about it. So.
All right, thanks, Lieutenant. Any questions, Chief, for the Lieutenant on CFC?
No, sir. It's a great program. It's a good way to make positive change in the community and for things that you think are important to you to give to. So
yeah, what's really cool about it is you name it.
Oh yeah.
For the cause, there you can donate. Is popping in to talk to us about everything going on in the public health realm. Over to you.
Okay. Hi, everybody. So we are definitely in a pandemic surge. Honestly, this is the highest number we've ever had in the pandemic. So this is not the time to be COVID fatigued and take this lightly. I am trying to sound the alarm bells as much as possible. This is the time to stay at home, not do those gatherings, and just kind of tighten down ship until we can get through this together. So I'm going to kind of show you what's going on in the nation, if we can pull up the slides. So here is what is going on as of today in the pandemic. If you can see that peak at the very end of that graphic on the trend line, this is very frightening, and you should be frightened of this peak. This is something that you should not pass off as nothing. We are at the highest we have ever been in this whole entire pandemic. This surge is not something to be laughed at or to be taken lightly. This is the U.S. as a whole, but California is following this trend as well. But this is definitely scary. You can see basically the U.S. is in red and is in extremely high-risk category. I think even higher than high, basically. You can see the states that are even higher than California. I think California is at 28. So we are not the worst of the nation, but the nation is on fire. And we are starting to see hospitalizations increase as well, really as high as we saw in the wintertime. So I know people think, oh, Omicron, hey, we've heard it's a milder illness. Hey, we should have Omicron parties, things like that. This is not the time to do that. We are going to see hospitalizations increase. We are going to see people die. We are already seeing death increasing. Death does lag about 6 weeks, so predicted that death rate will start rising in February. As we start calculating, people are hospitalized sometimes 6-8 weeks before they pass away. So this is not the time to give COVID to your friends or your family. You need to stay home. You need to be very, very careful right now. You need to wear that mask. You need a physical distance. Omicron is not a joke. We are also seeing, unfortunately, a rise in kids. I have diagnosed more kids than I like to diagnose with COVID in this last couple of weeks, especially our younger children. They are getting hospitalized. Children are at risk for multi-inflammatory syndrome in children where they can get COVID and then a month or 2 months later have a really bad inflammatory response where that ends up in the hospital or dying. So we are definitely going to start seeing that in the next few months. So please be cognizant that we are not in a good situation, and you know, if there's anything you can do, all the things that we've learned in the last years, this is the time to do it. This is the time to just stay at home, really not do any kind of social gatherings, just do what you need to do. This is the time to telework. That is not, you know, just words, that is an action to be able to stay at home, continue to work, but do it from a safe place, if at all possible. So Omicron is really, really contagious, and really that's what we are seeing predominantly right now is Omicron. I've sent a few samples out to be sequenced from Edwards. They all came back Omicron. It's very contagious. You can also get reinfected. So we have seen a lot of people who got the Delta variant infected, and they're getting Omicron. I didn't put this on here, but Florida was a state where Delta kind of raged through in the summertime, and their rate is even higher now with Omicron. So reinfection doesn't really protect you. It has a shorter incubation period, so people are getting exposed, and then 2 days later they start getting sick. So that's really, really high. In the household, if you have somebody infected in your house, most likely you're going to get it, including children. I just had a 9-day-old that got it. So the symptoms can just be a sore throat. It can just be a scratchy sore throat and nothing else. People have discounted as just a cold. So just be aware that if you have a sore throat, if you have cold-like symptoms, runny nose, especially if you've had any kind of exposure or high-risk activity like traveling over the holidays or any kind of gathering, just presume that you have COVID and stay home. We are not seeing the loss of smell or taste or the fever, cough as much. It is really more of an upper respiratory infection, again, sore throat. You can get some tiredness and headaches. Those are usually the most common symptoms, but they can result in hospitalizations and death. So what can you do right now? You can get vaccinated. You can get boosted if you've been vaccinated. This is the time to get our kids vaccinated, 5 and older. This is the time to get you boosted, 12 and older. If you're pregnant, please get vaccinated to protect your baby and your pregnancy. And this is the time to stay home if you're sick. If you feel under the weather in any way, sore throat in any way, please stay home. Supervisors, please allow your folks to stay home if they're sick. And that is really the main thing. Please continue to wear a very tight-fitting, well-fitting mask. Be aware that influenza is going to start being seen in California. We've already seen influenza rise in the Northeast region, and we are starting to see in LA County, I think they reported a person that was infected with COVID and flu. So that is definitely going to be on its way here as well. So just be aware that those are all going to commingle and be worse symptoms coming forth. I'm going to have the next slide, please. So guidelines change, and it changed, unfortunately, over the holidays, and I know it's been very, very confusing. On the Edwards installation, we are following the California Department of Health guidelines, which really mirrors the CDC guidelines, except for one important item. So the new guidelines is really that you still do a 10-day isolation. If you are sick and you have COVID-19, either by a test result or by somebody saying you have COVID-19 because you have symptoms and you were exposed, then you need to do a 10-day isolation. Plan for a 10-day isolation. If at day 5 you are feeling good, like almost 100%, you haven't had a fever in the last 24 hours, your symptoms are pretty much resolving or resolved, and you're feeling a lot better, and you feel like, I need to go back to work, I need to get back, I need to get out, I need to go do something, I need to be able to go back to work, it's a mission requirement, I really need to be there, and I can't telework or things like that, and you're feeling great, then you can do an antigen test. If you do an antigen test and that antigen test is negative, then you can go back to work on day 6. If that antigen test is positive, you need to continue that 10 days of isolation and continue for the next 5 days. If at day 5 you still have symptoms, you're not feeling great, you're still feeling like, hey, I'm still coughing, or I'm still having a lot of runny nose, I'm still not feeling 100%, just go ahead and continue in that 10-day isolation, isolate for the next 5 days. So for supervisors out there, I would really recommend just planning on it, on somebody who got infected to be out for 10 days. And only if the criteria of a negative antigen test with really no symptoms is met can they really come back to work. Even after they come back to work, they still need to wear a very tight-fitting mask and be very cognizant that they could still potentially be contagious. So it's not like the virus read these rules and said, oh my gosh, it's day 6, I need to stop being infectious and stop replicating. These are just guidelines to help with the majority of the situations, because in the majority of situations, they have seen that you're not as contagious after day 5. But that doesn't mean that in the individual, they are not contagious. So that wearing that tight-fitting mask, even on days 6 through 10, is still extremely important. So if somebody can telework, or if somebody can not have to be at work, I would still recommend trying to keep up those 10 days. The quarantine guidelines also changed. So at this point, it is a 5-day quarantine. So if somebody got exposed to somebody with COVID, or were in kind of maybe a high-risk situation where they may have been traveling, the recommendation is to do a 5-day stay-at-home or 5-day quarantine. Get tested on day 5 after the exposure, tested day 5 after the last exposure. If that test is negative, then you can assume, or you can feel a little bit more comfortable that you're good to go, but you still need to wear that tight-fitting mask and still think that you may be infectious, even from days 6 through 10. Here's a little bit of a difference. If you're boosted, or you're recently vaccinated, or you're not eligible for a vaccine, for a booster, then you don't actually have to stay at home. If you're unvaccinated, or you're fully vaccinated, but you are eligible for a booster, then you need to stay at home. So that's really the little bit of a caveat to the quarantine guidelines. If you're boosted, you don't have to necessarily stay at home. You still have to test at day 5 and be very mindful that you could potentially be infected, but you don't necessarily have to stay at home. If you're not vaccinated, or if you haven't gotten your booster and it's been more than 6 months, then just basically stay at home for the 5 days. So this is just a snapshot of what we are going to instruct, or for Edwards Air Force Base, for access to the base and access to the workplace. Just as a reminder, when public health does do contact tracing. So public health will call the person who is infected. They will ask the person who's infected who they were close contact with 2 days before the person either had symptoms, or before a positive test if they have not had symptoms. And then all those close contacts of that infected person will be contacted to determine what their quarantine rules are. If public health tells you to isolate, if public health tells you to quarantine, that needs to be followed, no matter what. If that is for access to the installation, in terms of the installation, that needs to be followed. Public health will not be trumped by anything on that. So that is a direct authority, I guess I would say, for access to the installation. So if you're told to quarantine or isolate, you need to do so. So this is, again, the guidelines. This really aligns with the CDC. The CDC makes that testing at 5 days for the isolation something that you can do, but you don't have to do. But for Edwards and for California, that is a requirement. All right, we'll go to the next slide. For testing, these are just some testing sites. We have been inundated at the Med Group with testing. We had over 200 people asking for tests on Tuesday, and we've had over 100 every single day. So I know the waits have been very long, but we are definitely doing our best, especially with this time where testing is very limited. These are other test centers, testing sites that are available. So just be aware that that is available. If you can get a home test, that is also great. I know the schools were giving out home tests for the kids to go back into school. So that is available. Please follow the directions if you're going to be doing an at-home test kit. If your at-home test kit or your antigen test is positive, you have COVID. You don't need a confirmation. You don't need to do anything else with that. If you have a positive antigen test, you have COVID. With the current positivity rate, there are no false positives with the antigen test. If it's positive, you have it. It's not a false positive. There are false negatives. False negatives are definitely, we are seeing false negatives definitely on antigen tests. Even on our PCR tests, we are seeing false negatives. So the bottom line is if you are sick, and especially if you were exposed to somebody that had COVID or you were in a high-risk situation, presume that you have COVID-19, follow the COVID-19 isolation guidelines, tell your supervisor, look, you know, I'm pretty sure I have COVID. I need to stay out for at least 5 days, if not 10. And whether or not you test or not, whether or not you have a negative on your test or not detected on your test, I would presume that you have COVID and just stay home. That really is the best advice right now during this current surge. Things may change, obviously, as we go down from the surge. This information may change, but right now during this current surge, as high of community rates as it is, our positivity rate is like 40% at this point. If you are sick, you most likely have COVID. Next slide, please. So huge push on vaccine. Please get yourself vaccinated. That is your best defense against the pandemic, against this virus. Even if you had COVID, even if you had COVID recently, get vaccinated. Vaccine is gonna boost your immune system. It's gonna make your immune system stronger against right now current variant, but also future variants. This is the only way this pandemic is really gonna end or really become more of an endemic in nature, is by getting more people vaccinated. And at this point, with how contagious this virus is, honestly, it's gonna take about 95% of our world to be vaccinated. So everybody really needs to do their part and get vaccinated. Having rates right now about 70% vaccinated is just not good enough to really get us into a more of an endemic mode with this virus. We need the world to be vaccinated, and vaccine is gonna be very important. Until the entire world is vaccinated, we probably will continue to possibly need some boosters. So this is the current guidelines. If you've been vaccinated with Pfizer vaccine, you can get a booster as early as 5 months from your last dose. If you've been vaccinated with Moderna as your primary series, you can get a booster at 6 months. And if you got the Johnson & Johnson vaccine, you can get a booster at as early as 2 months from your dose. Boosters are now approved for 12 and older, especially for Pfizer. So if you are 12 and older and you had your last vaccine, your second dose, go ahead and get boosted if it's been more than 5 months. And then pediatric vaccine. I really want to push peds vaccine. This is really important. I am seeing a lot of kids get COVID right now. And like I said, we are seeing hospitalizations go up especially in the Northeast, but that's going to come down to California as well. Being mindful that even with Omicron, kids can get really, really sick. Even the younger kids, because it's more of an upper respiratory infection, the younger babies, they're going to get their noses clogged up, just like RSV. And it's going to be very concerning for them to be able to breathe when their noses are all clogged. So really getting more of our population vaccinated is really important. So the 5 and 11, it's again 2 doses, 3 weeks apart. It is a smaller dose, so there really has been less side effects for kids and for adults. So I know every adult is very worried about that second shot. Sometimes you can get a lot of side effects from it and feel down for a little bit. But really, most kids tolerate the vaccine extremely well. It is a smaller dose, and that may be the reason why, but the pediatric vaccine is tolerated very, very, very well. So it's a very safe and effective vaccine. It's been out now for really a few months, and so really don't hesitate to get your kids vaccinated. If they're vaccinated, they don't necessarily need a quarantine, which is very helpful because that keeps them in school as well. And then another push for pregnancy. If you are thinking about getting pregnant, you are pregnant, or you just had a baby, do your part, get vaccinated, protect your baby, protect the pregnancy. In pregnancy, you are higher risk of having complications if you got COVID, of miscarriages, stillbirths, premature labor, premature births. The best thing you can do for your baby is to get vaccinated. That's really the bottom line. There's more and more research that has shown that. We've had the vaccine out in pregnant women. The babies that were born to vaccinated pregnant women are now a year old. And there's no adverse effects to the pregnancy, to the baby, to your offspring, your child, to get vaccinated. But there is a lot of danger if you remain unvaccinated and pregnant. So if you're pregnant, do your part to really protect your baby. If you want to do everything you can to protect your baby, get vaccinated. The good news is that babies are born with the antibodies from their mother, so they are protected at birth if their mother is vaccinated. So that is really, really great news. So just some vaccine links. To find a vaccine center, go to vaccines.gov, or you can text your zip code to get vax. So that's the informational there. Palmdale Oasis Recreation Center has all vaccine available. They're open every day from 12 to 6. They're a great place to go get it. The Med Group is also providing that vaccine by appointment only. I did put up the link as well. If you just Google DHA appointing portal, you should be able to see that. It's the first link that comes up, the DHA appointing portal. But go ahead and sign up on that. We are right now doing vaccines every Wednesday, and my understanding is we're going to also offer the PEDS vaccine 5 to 11 on Thursday afternoon. So please look for those links. For pediatric, please look for the specific pediatric appointment on the 412th Med Group. But that is going to be available. So please encourage the vaccination. That's really, really important right now to get your booster. The booster shots are extremely important right now. Next slide, please. And then mask wear. There's a study that came out that showed of all the mitigations that are non-pharmaceutical, so non-vaccine, so the physical distancing, the hoods, the plastic barriers, all that stuff. The one that really shined in terms of the best mitigation for all the public health measures was mask wear. It reduced COVID-19 infections by 53%. That is huge. I kind of mentioned Florida at the top of the talk. We all know that Florida does not mitigate anything, does not require mask wear or any of that stuff. They got burned up with Delta, and they're getting burned up with Omicron. California has done extremely well comparatively with a population that is larger than Florida, primarily because California has been very proactive about making sure that people are wearing a mask and testing and doing a lot of measures. And so this is really important to wear a good face mask. There's a lot more reports showing that the quality of the face mask is good, is something that we might want to increase. So the first thing is just wearing that mask correctly. So that first, the pictures of people slide, the person that has a good check mark basically is somebody that has a really well-fitting mask. It's over the nose. It's underneath the chin. It's tight-fitting, so there's not any gaps in between, gaps up here, gaps down here. So you want a mask that doesn't really have any ability to gap up. So that second picture of the child, his mask is a little too big for his face. You can kind of probably not see on screen very well, but it's a little bit wrinkled. So you want a mask that's really well-fitting. And I know when we talk and things like that, it kind of comes down, so sometimes you do have to adjust. But you really want a well-fitting mask. And obviously, I've seen so many people with the mask just under their nose. I don't know how you wear it, because to me it's very uncomfortable, but I've seen that. Don't do the chin guard stuff. So those are just, wearing the mask, first of all, is really important. Second of all, wearing a better quality mask is maybe very helpful. So triple layer for your cloth masks, if you're gonna do it, do triple layer. But better is the surgical mask with the cloth mask, so double masking. Or having at least a surgical mask is going to be a better protection than just the cloth mask itself. And then really the better mask are your N95s, which typically are reserved more for healthcare workers. But there's a lot of KN95 and KF94s that are available. I just ordered some for my kids from Amazon. It came in one day, so that is readily available. And upgrading our mask, our quality of mask, I think is really important right now with this pandemic. I've been calling patients back, and people usually had an exposure to somebody known, but now I'm seeing people who really didn't know where they got it from. They just went out to the grocery store and they still got it. And otherwise, so right now wearing a good quality mask is really, really important. We can't completely rely on being vaccinated and boosted. We also have to continue to add that mitigation right now of the mask wear and just being mindful of that at all times. I think I have another slide. I may not. That may be my last slide. Okay. So that is my last slide, everybody. So I'm hoping that helps a little bit to kind of explain the situation right now. I am going to say this is not the time to do routine medical care. Continue to take your medications, continue to take care of yourself. But if there's something, but medical, not just here in Edwards, but also in the community, is being overwhelmed right now. So
Sorry, Eve. I got hit really hard with first it was a kind of a cough, and then I felt ill, and I couldn't really explain it. I thought I ate something bad. Went to bed that night, had a hard time sleeping, so I chalked up my tiredness to I just didn't sleep well. And then I woke up the next, and our hip pocket information, sorry, my phone died. We have 129 kids, 34 staff in quarantine status from 11 positive COVID cases right now, which were 8 caregivers and 3 students. But the ones that are in quarantine, if they were vaccinated, according to this, and they're not eligible for a booster, they don't technically need to quarantine. Is that
correct for the school age program, because that's the 5 and older. So for
Okay.
the CDC, public health has determined, because they can't wear the mask very well in the younger population, that if you're obviously if you're infected, you're going to do a 10-day isolation for those kids.
okay?
And really for the CDC, because they're a little bit of a higher risk work population. So we are still requiring the CDC to be 10 days of isolation for positives, but then the quarantine would be 10 days because the kids can't wear the mask. So on that slide, it's really, you can go back after the 5-day quarantine only if you can really wear that mask, and that's extremely important. You still have to be very cognizant that you could still be infected and just not know it yet, because again, you're contagious 2 days before you have symptoms. So if you've been in the workplace for 2 days and on, Wednesday, on Friday, you find out you're sick with COVID, you already infected all of your work population for the last 2 days. And at the CDC, that, with the kind of congregate situation, they eat and drink together and all that kind of stuff, it's a very, very high-risk place. So we are trying to do our best to make sure we're mitigating that as much as possible.
Yeah.
For the CDC specifically, it is 10 days isolation, 10 days quarantine.
Okay.
The school annex, yes, if your kid is fully vaccinated, you don't necessarily need to quarantine, have them stay at home, but they still need to get tested. They still need to be instructed, the kids, to wear that mask really, really well and just be cognizant that they can be infectious still.
Gotcha. Yeah, so for everyone watching, she's already talked about it a lot. We're getting hit pretty hard with this variant, and it's affecting our CDC. I recall last year during Delta, we started getting hit really hard at the CDC and school age programs as well. So it's kind of a repeat right now. In fact, the numbers are pretty comparable as to how hard we got hit. In fact, my FSS commander has sent me some comparison data from, well, this was 27 August 21, so it was a while ago, where we had 127 kids out on quarantine and 15 staff in quarantine from 5 positive COVID cases. So bottom line, this is going to have mission impact. There's going to be a lot of parents that have to stay at home with their kids and do this 10-day quarantine or 10-day isolation if they are positive, and figure this out. And then hopefully the spike starts to drop after we get through this initial phase. Chief, have you seen any questions? I think that was one of the questions that was on there.
The next question was, are the staff members that are put on quarantine getting paid? Specifically, I think in the CDC is what they're asking me.
Yeah, so that's a question for the FSS. If they text that in, we'll get back to you on that. I think that's more of a personal question for those staff members.
Absolutely.
So they can talk through their supervisor on how that process is going to work. I would assume so, but I don't know the rule sets for, depends on, there's different categories of CDC staff members, NAF versus APF. So there's different rule sets, and I don't know what the status is going to be. So what else we got?
That's all we have right now. No new questions come in yet, sir.
If I could mention something too, if you do get COVID, like your at-home test is positive and you have COVID, or you got exposed to somebody with COVID, please obviously let your supervisor know, but please let public health know as well. Public health, 661-277-2244 duty hours. Please let them know so that they can give you the guidance of what to do, and so that they can get your contacts and do contact tracing. That is their job, and they are more than happy to do that. But please be aware, obviously, we are getting tons of cases. Since Colonel Harris gave out numbers, I will give out numbers too. We're getting about 50 cases a day right now, and that is huge. Our positivity rate is up almost 40% at this point, just with our test center alone. So we are definitely inundated. So please be aware that public health is very, very busy. There's only about 5 of them trying to do all of this. For every case, there may be 3 or 4 contacts that they have to call, or possibly even more. So again, they're very busy, but please do give them a call so that they can give you the guidance. Please, as supervisors, please rely on public health to know, they know what they're doing. So just trust in them. If they're telling that your member needs to quarantine or isolate, please don't argue with them. Please provide them that support. As supervisors, we are definitely trying to do our best. The public health flight is definitely trying to do their best. Please support them. Please be respectful for them. They've gotten yelled at by supervisors, yelled at by people, complained, argued, and really they're just trying to do their job. So please support the public health. Please give a huge shout out to them because they are doing an incredible job under enormous pressure, and we're definitely trying to do our best. It's a huge surge. It's a huge workload that we're trying to get through every single day this week, and it's probably going to get a little bit worse before it gets better. So just be mindful of that. But please do give them a call. Just understand that they may be on the phones, and so you may have to call again.
I appreciate that, and you're right. They are doing a lot of work, and we really appreciate all the work that they're putting in. In fact, when I tested positive, someone called me and went through the whole thing, and I had a lot of questions on what I could and couldn't do, and they were very patient with me and answered all my questions. So, if supervisors or people if they're calling you to tell you to do something, listen to what they're trying to tell you to do. Like she said, they know what they're talking about, and they're just trying to keep you and the rest of the base safe. And that's what it really comes down to, is making sure we have lessened the mission impact on base and keeping people alive. I have a question real quick on the vaccine. So we're talking about boosters, and I got boosted this morning thanks to the med group opening up another day to do. I think they had some walk-ins today to do some boosters. I got an appointment and went in and got myself and my teenage daughter boosted this morning. But we were all already vaccinated through the med group, so we had Pfizer on Pfizer. So all 3 shots are Pfizer. For those folks that say they got Moderna or Johnson & Johnson, the booster can be any
so
brand. They can go anywhere. If they're getting a booster, they're getting a booster of whatever they have to offer. So you guys are offering Pfizer. They got their vaccination, like my wife is vaccinated off base and she got Moderna. But if she wants to get a booster, she can go to you guys and get the Pfizer booster.
Yes, sir. Yes. Yeah.
Okay.
The CDC, FDA allowed the mix and match, so a booster is a booster.
Copy that. Chief, anything?
So, sir, I have an answer. We had the phone a friend come in, and absolutely they're being paid. The CDC workers they're being forced to quarantine. It depends on the different categories and status they need to be in, and supervisors are briefed on what the correct status to put them in, so they're still paid. And I've got some other stuff coming in here. Does medical recommend wearing a face mask outside?
So it's a good question. I think, like we've said before, if you're going to be in a setting where there's others outside around you, like it's kind of in a crowded area, and it's hard to kind of completely distance from each other, I probably would do the safer thing and wear the mask and just be aware of that. But if you're going to be outdoors and just taking a walk and there's not a lot of people around you, or just doing something real quick or something like that, I don't think you necessarily need to wear a mask because the ventilation, obviously, airborne ventilation, it's just going to kind of go away into the air. So again, it's that individual risk assessment, right? If you're going to be going to this crowded area, maybe like an outdoor mall type of thing, something like that, you may want to wear that mask because you're going to be passing around a lot of people and it's going to be in some public crowded places. But if you're just going to be outside taking a walk or going for a run on the track and things like that, you're really not going to be passing a lot of people. You don't necessarily need to wear a mask outdoors.
Yeah, that's the thumb really is if we go into a outdoor public setting that is crowded with a lot of people, like outdoor shopping malls and festivals or anything like that. Like there's a really nice food festival, a bunch of food trucks down in LA that we've went to a couple times, and it gets pretty crowded down there, so we wear a mask while we're walking around there. We grab our food, go find a table, and then that's when we take off our mask so we can eat. But as we're walking around, we typically wear a mask if we're in those crowded areas, just to stay safe.
Yes, sir.
Extra level.
It's important to stay safe in this time. We heard all the information from Colonel Westy. It's blowing up, so you got to take care of yourself and others. Had a question pop in. Will we be going to Charlie?
That is. I was waiting for that question. I probably could have, preempted that question. So I don't know right now because there's still some things that we're working through. I know we have our scheduled COVID CAT meeting on Tuesday. I know we're working through what does Charlie look like for each of the units, especially the MSG, as we own all the services on base, and so in working with public health in determining how does that look different than Bravo Plus, how is it that we can mitigate better but still maintain some level of service and still provide an environment for folks to still enjoy themselves but yet take care of each other. So more to follow. I anticipate next week we'll hear more as the leadership team here at Edwards works through what does Charlie look like for us and should we be there. And ultimately that's going to be the boss's call on if we move to Charlie or not. And at this point, I have no indication from him that he is definitely planning on doing that. I know we're talking about it, but I don't know that we're planning on doing that. So hopefully that answers the question right now. I wish I could give you more, but stand by for more information coming next week. Colonel Westy, have you heard anything else you want to add to that, or?
I laugh only because in reality, as an informational standpoint, we're in Charlie. From an informational standpoint,
We're already there.
We're already there. I
Yeah.
mean, honestly, at this point, we may even be in Delta.
So what does that mean for the base?
Right. So I can't, I can't tell what it means for the base, but just from an informational standpoint, if you need that Charlie Delta to know, hey, are we in crisis mode or not? We are in crisis mode.
Exactly. Yeah. So what changes on the base, right, is if we go to Charlie, and those things haven't been determined yet. I know we have a proposal up to the boss as to what we think we want to do in Charlie. And a lot of it, you've done it before. I hate to say it that way, but we've been here before. We've done it. We got through it. It sucked while it was happening, but it did help us, I think, get the trend down.
Yeah.
So if we have to do it again, as long as everybody follows the rules, I think we can turn this trend off and get back out of it as quickly as possible. Anything else coming in?
No, sir. Nothing new.
Yeah, I feel like we're, as Colonel Westy talked about, it's the COVID fatigue, right? But this is it's hitting us again, and we have to, protect ourselves and protect the people we love around us, and just follow these guidelines and wear a mask. I'll tell you, there's something for me personally, and if I know a lot of people aren't on here watching right now, but if you are, and you are a gym goer on base, please help me out. Please wear the mask. There's a big sign as you walk in the door that the mask is required. Just remind your peers. Every place you go on base that we have an expectation, we have the installation command directive that has directed us to wear a mask indoors, regardless of vaccination status. Just follow those rules. It's that simple. All right, that's my soapbox, and I don't want to keep beating that horse.
It's just about doing the right thing, right?
It is.
I mean, we've heard anecdotal evidence from our medical professionals over here that the mask makes sense. So just put them on, keep them on, and do the right thing. So we have another question. Oh, no, that's one. And I don't know if we can go into this, but they're talking about what changes are being contemplated at this time if we go to Charlie.
Yeah, so I'll direct you to the omnibus that was posted I think it's been published over a year now. I'll direct your attention to that. That's a good starting point to look at what Charlie means, at least for base access, and then just take a look at what types of things we couldn't do in Charlie the last time we were in Charlie. Some of the things, and I'll give you an example, like takeout only at restaurants, right? There are things that, not a lot of things, because we're already doing pretty well, I think, with some of the restrictions that we have. So it's minor tweaks and stuff. It's not like we're gonna shut down the base, at least yet. If we get really bad and we end up in HBCon Delta, that's when we start shutting the base down. So just stand by. Bravo Plus is pretty restrictive already. We're down to 40% capacity for establishments. So that's already bringing us way down. And there is guidance out there that talks about 25% when you go to Charlie. So those are some of the things, but we'll get more information out as to what Charlie means as we narrow down exactly what kind of measures we want to put in place for that. Nothing else?
Nothing new, sir.
Okay.
If I
Well,
can, I
yep,
just
go
got
ahead.
word that PEDS vaccine for COVID will be available on the 13th of January.